Welcome back. The cost of care. The Institute of Medicine now proposing a 2% tax on people who have health care coverage on nearly all everyday health practices, which means every time you go to see a doctor or fill a prescription, you'll have to pay a new 2% tax.
So that tax expected to bring in a reported $13 billion of revenue that would be put towards public health services like anti-smoking and vaccination programs. But is this report just a boondoggle for public health experts and their friends?
Joining us right now to weigh in is Elizabeth Price Foley, professor of constitutional law at Florida International University and author of Tea Party: Three Principles. Good morning to you, Elizabeth.
Good morning to you both.
This boondoggle, another 2% tax, just what we need, as everything's just going along so well.
Yeah, you know, it reminds me of Alice in Wonderland when I read this report. It'd be nice if something would make sense for a change, because here they are, they're trying to tax every single transaction we have with healthcare providers. So every time you see the doctor, every time you fill a prescription, you'd pay this tax. And this is, you know, not going to do nothing but raise the cost of healthcare. And you raise the cost of healthcare, that decreases access to healthcare. Sure. It's the exact opposite of what they're trying to accomplish.
Okay, so I'm trying to figure this out, Elizabeth. Is this something that the lawmakers didn't bother to read before they passed the bill? Or is this just something that was a result of it after it was passed?
Well, you know, I mean, this isn't law yet. This is just an expert report from the Institute of Medicine, and I've been on IOM panels before. I've been one of those experts, and I can tell you that they are boondoggles, because what this was basically 18 public health experts. And, you know, expert panels tend to think that their own issues are the most important issues in the world. And not surprisingly, they also think the best way to solve those problems is just to throw a lot of money at them.
That's exactly right. But what's interesting, when you look at the data, the states and, for instance, the District of Columbia, where they spend a lot on patient care, they're not necessarily the healthiest places.
That's right. So if you look at the data itself, if you look at the lowest per capita spending states, you'll find states like Arizona, Wisconsin, Missouri, and those states have amazing public health statistics. They have low infant mortality rates, low rates of obesity, high vaccination rates, and you compare them to the highest per capita spending places, which include like the District of Columbia, West Virginia, Alaska, which have sort of notorious and persistent public health problems despite spending 10 times more.
Good point.
So it would be people who have insurance who would pay this 2%? Could you tack it onto your insurance, or you'd be just paying this out of pocket?
Yeah, no, this is a tax, so it doesn't matter whether you have health insurance or not. If you simply access the healthcare system, you'll be paying more for that healthcare that you receive. And you know, they think it's going to be some panacea for our public health problems, and it's clearly not going to be. You know, public health is a sort of notoriously complex and multifaceted problem, and you can't solve it just by throwing money at it.
Yeah, a tax is a tax. All right, Elizabeth Price Foley joining us from Los Angeles, where she and the camera person are the only people we know who are awake at this hour. Thank you very much for getting out so early on this Monday.
Thank you very much.
You bet.